So the other things you can do include setting up a filter for other departments. So I mentioned the fact that you can go through and set things up on the left. You can also just come here. So you can, this is where labs was saved. You can just come here and click the plus sign, make a new one. So here are some good ones. I think nursing is a good one. I think that respiratory is a good one. There's nutrition is key. And so now over here on department filter, you can see the things that you just saved. So let's do diet. Okay, we can see what these patients' diet orders have been. And usually, this is outdated because it's the training version of POE. There would only be one active diet order. And that's a real pain because you can't see what was previously ordered. So the only diet filter that I have is one with no status or priority filter. And so you say, so we got diet as the department, no status as the filter, and then I will save my current. Call it diet history. And so you can very quickly see what type of food you should be ordering for this patient that you're cross-covering that just came back from a procedure and you don't know what they've been eating. So it's very, very nice because all of these would be italicized and grayed out like this one, and the only one you would have seen was the MPO. And you know, you can also quickly see these terrible tube feed orders, and they're such a pain to put in, but at least you can have the information handy in an expedient way. Same thing for the other filters. Nursing, I just save as a normal. I don't do anything with this status or priority filter. I just call it nursing. It's just a fast way to get to that department. Respiratory, I save with no status or priority filter, so you can see all the different things they've been on in the MICU. You can see what vent settings have been changed. There's other ways to find that in the flow sheets, of course, but that's how I like to do it. So you can save that one. Now, the other thing you can do for orders is you can place actual filters with specific orders. Okay. So for example, this is one that I have, and I'm actually just going to go over to my POE so you can see it there. Modify, just open it up. So I have all the things that a person could be on for DVT prophylaxis or for therapeutic anticoagulation. So then when I'm curious what their DVT prophylaxis is, I just click on that and it would pull up. So if this was the case, it would show me this patient isn't on anything, including TEDs or SCDs, sub-Q heparin, whatnot. So that's a nice way to verify that you've got the patient on things you want. I have a similar filter for insulin, just to be able to quickly pull up the insulin order so I can edit it or change it or see how much sliding scale they had. I have pre-op, which I don't use that often, but it shows you, I just have like a routine pre-op orders, NPO, if they want a urinalysis and an ABO and a PTT and that kind of stuff, you can find that out quickly there. A radiology department filter, similar to the other ones we already talked about. Medications, I'll mention that one in just a minute. Care coordination, that is the physical therapy, OT, SLP department filter. So I think that's a good one. This is for echoes and cardiac imaging. Intern is another one that I'll mention. So the intern one is basically just making a department filter for the admission orders, and it quickly pulls up who's supposed to be taking care of that patient. I just think it's a nice thing to be able to pull up quickly. All right, the last one that I said that I would mention was what? Oh yeah, the medications one. So for whatever reason, POE will not let you do a couple things. It's a funny little program, and it won't let you just make a department filter for the pharmacy tab. But you can make it if you tell it to only give you active meds. I'm trying to remember the details of why I made this filter, but it's because whenever you're trying to see what meds a patient's on, if they have pre-transfer orders at the same time, it's just a real challenge to tell what they're actually on at that time. So it's pharmacy. No transfer is my, okay, yeah. So I just did everything except for transfer orders. I'm not explaining this one very well, so I'm just going to back out and not keep talking about it. The other thing that is, I'll just mention on the order screen, is the ideal way to see how many doses of a general medicine the patient has had. So you right-click on a medicine, go to View, Order Task Summary, and you can see every episode of sub-Q heparin that a patient has gotten. If this was a real patient, they would have several green boxes showing you when they got it, or red boxes if they refused or something like that. You can also click Include Orders with the same generic name and hit Update List, and you'll pull up all the different heparin orders. So this is great for insulin, for antibiotics, for really any medication that's come off and on their MAR. You just click then Expand All. You can organize by date ordered. And it's an easy way to see, to count up doses and not have to go through the Rainbow MAR worklist manager thing. Okay, so I just want to make sure talked about all the important ones. Order entry session, that's an important one. So I said at the beginning to leave that one on. And what order entry session does is it pulls up, it totally rearranges the orders in a per session manner. So this NPO order was placed by itself. You can see it's dropped down with that specific order time. This tube feed order was placed by itself. This Barker service order was placed by itself. And then these are all the pre-admission orders that I did earlier in a different video. So you can see it groups things as they were ordered. And the reason that's so helpful is it's the most recent at the top. And if you do a no status or priority filter at the same time, and save it as whatever you would like, then you can see things that have been performed, tasks that have been performed at not just meds, but anything will come up to the top. And they'll be italicized once they're discontinued. See, I'll discontinue this order. Whatever. And then if I go to order entry session, all I see is the MPO. But if I go to order entry session plus, I see that there was actually a tube feed order in between. It's disappeared because it's discontinued. Likewise, if I discontinue Ativan and some of these million Tylenol orders, I won't see them unless I go Provider Plus. And then it will show me, oh, there's an Ativan order that was discontinued, and there's 2 Tylenol orders that were discontinued. Now, interestingly, these don't show up in order entry session because the orders weren't placed. So you just have to know the limitations of your filters. There is one other way to find this stuff. I haven't found it to be all that useful, but the order maintenance details filter with the no status, it will show you, should show you everything that was done. Even if an order was placed a week ago, if it was just discontinued, it should pop up to the top. So I have that one saved on my screen as well. I don't use the, sorry, I didn't name it the right thing, but I don't use this one. I only use this one, and I don't use it all that often. But you can see it theoretically would tell you every order, not only that was placed, but that was discontinued, that was canceled, in a chronological kind of fashion. So the key is to be able to find what you're looking for quickly and to have it organized and at your disposal. And so hopefully these filters will be helpful in accomplishing that.